The eye-opening number of cases from Tarrant County today that was released, 1,673 newly reported cases, more than any other county in North Texas. But this number that we saw today requires some context, and it's worth talking about. It's not nearly as extreme as it seems at first. That's because today the county, for some reason, suddenly changed the way it reports cases. I'm Doug Dunbar. Good to have you. We're streaming live as we do on CBSN DFW. So Brooke Katz has been looking into this. She's in the Fort Worth studio tonight, getting some answers as to why the sudden change, which caught a lot of people off guard today.
Yeah, Doug, and this is all a result of a change in their definition of new cases. That number now includes, as you mentioned, probable cases, not just confirmed positives. So today they tell me 600 of the 1,673 were confirmed cases. The rest probable. And this is something other counties are tracking, although they're not necessarily combining the numbers in that way.
It is maybe a more accurate reflection of how much transmission and what's actually going on in the community.
Dallas County Health and Human Services Director Philip Wong says they started reporting probable cases of COVID-19 last week. It comes as state health officials are working to get agencies reporting uniformly across the board.
This is not trying to do anything to, distort the numbers, or not trying to, cook the books or anything. And that's why I think it's real important to be able to separate confirmed and probable. And then if everyone's used to hearing confirmed, be able to compare those apples to apples.
So why track probable cases?
If you don't pick those cases up, then a person who could probably be infected is going to be slipping through the cracks, and they're probably going to infect other people, and that's going to definitely be a problem for all of us.
Dr. Diana Cervantes is an epidemiologist with UNT Health Science Center. She says the case definitions are mostly for public health officials. This way, they're following up for anyone who's likely infected.
So this wouldn't be a scenario where somebody walks into a clinic per se and just says, oh, I have a cough and I don't feel good, and they haven't been in contact with somebody with COVID. There would actually be some criteria that has to be met for this to be a probable case.
A probable case is going to be somebody who has certain COVID-like signs and symptoms, and they came into contact with a confirmed or a probable case.
Either way, she says it boils down to the health department casting a wider net to keep more people safe. And just to be clear, state health officials wanted all agencies reporting probable cases by this week, by the end of last month. And by the way, probable also could be classification based on the type of testing that's done in someone showing symptoms, like an antigen or antibody test. Tarrant County did tell me tomorrow's numbers should look a little bit more normal because today included a backlog of those probable cases. Doug?